Muy buenos días. Nos encontramos
Hello,
en
good
la sede de
morning.
la
We are
Conferencia
on the
Interamericana de Seguridad
headquarters of
Social.
the
Un gusto saludar a todos.
CISS. It is a pleasure for us to greet you, both in person and through social media, and those who joined the Zoom meeting. To begin with this week, we have Ms. Maestro Alvaro Villarca Hernandez, who's the chair of this conference, will address the public. Hi, Tere. And good day to everyone who's with us across all different channels or here in person, here in Mexico City. I'd like s- to extend a nice hello to all of our members, to Zoe Robledo, who's the General Director of the Mexican Social Security Ministry and who is part of this CISS. Also, here with us we have the supervision of the short-term Social Security for the plurinational state of Bolivia, Pedro Alcántara, who's the policy director for discapacity for the Dominican Republic and the vice president of the Commission of Actuary, and also the doctor of, from Colombia, and Mr. Cohen Lemig, who's the coordinator for SOCIOE, which is an initiative for the UE for social protection, work, and employment. Well, welcome to everyone. Please feel at home. Also, I'd like to thank the presence of everyone who's joining us to these activities of CISS. We are really thrilled to be with you. Today, we are facing the initiative of having our states to declare the last week of April as the Social Security Week as of 2009, as part of our 15th meeting. We had the International Society for Work and representatives for regional institutions who gathered in Guatemala City. This is to try to improve and increase the efficiency of the different strategies for social security across all levels. From there, we promoted the Guatemala Declaration, that was backed up by organizations such as the WHO, the Pan American Health Society Organization, the American States Organization, and the High Commissioner of the UN for Human Rights. It aimed to buffer the lack of knowledge regarding Social Security and generating the interest of the public in the topic and that everyone can understand this right to an inclusive Social Security. Within these activities, we will have the participation of 23 institutions that are members of the CISS across all subregions and the different commissions. We'll also be with 20 persons who are functionaries of ally institutions. I would like to thank everyone's collaborations. These years we have a diverse and rich program across the different topics. American Social Security is the case of Bolivia, the investments in in retirement funds, advancements in Social Security in the context of climate change, portability, the future of Social Security facing uncertain futures, aging, public policy, and Social Security with a discapacity perspective, and learnings of COVID-19 from the Social Security perspective, and HIV. All of those interesting topics for all of our memberships and viewers. Also, I'd like to thank everyone, especially from the subregions and commissions, because they have shown a great commitment, collaboration for this creation that help us to place Social Security in the center of the regional and national agendas. We also have the opportunity to identify the best practices between member countries, acknowledge the areas of opportunities, and prepare for the challenges that all social security institutions must face in the benefit of our populations. I hope that in this edition of the Social Security Week will have a space for knowledge interchange and in strengthening our conference. So, with no further ado, I officially declare this Social Security Week 2024 open for everyone.
Muchas gracias, secretario general, por sus palabras. A continuación, y para dar inicio a nuestras actividades del día de hoy, cedo la palabra a Brandon Pérez, quien nos
Now
presentará
we'll have Brandon Perez, who will
quien estará
introduce Dr. Jorge Roquemoyo, who will make the presentation. Thank you very much, Counselor, and everyone here. Also, let's remember that all panels will be available in Spanish, English, and Portuguese, both in Zoom as well as through the social media of the conference. Also, if you are registered on Zoom, when we reach 80% of assistance to the panels of this Social Security Week 2024, we'll have a certificate of assistance. As we heard previously, we begin these works with the presentation of the Bolivian case. So I will introduce you Dr. Ruben Colquemoyo, who in November 2023 was designed as the directive for the long-term Social Security organization granted by the Bolivian president, Luis Alberto Arce. He has a great experience in the field of social security on short term and health. He was part of the ASA's office for La Paz. He is a physician and surgeon by the San Andres University, and he has studied epidemiology, public health, and quality assurance. Now he has been working on studying on short-term social security. Thank you very much, doctor, and we will have the floor. First of all, I'd like to greet everyone. Hello to Mr. Alvaro Menarca. Thank you for this warm welcome to everyone who's present here. I'd like to mention every one of you, but I don't know every one of you. Hopefully, by the end of this week, I'll be able to do that. So please receive the greeting of the ministry, Maria Rene Castro Cusicanqui, who has appointed me to come to this event, which I believe is important because as a plurinational state, we are trying to share experiences and work with Social Security so that we can emulate on the short, middle, and long term what's being doing by other countries. And this event will be helpful in my condition as Executive General Director to let you know about the state of Social Security, what's the work we've been doing as authorities in terms of the short-term Social Security, and what's the perspective and goals we aim to achieve. Those are the elements that I will try to expose, and I hope that by the end of this week, we'll have several pebbles of knowledge and all of the experience that's important to improve in this highly passionate topic, which is social security. In Bolivia, we have a disaggregated short-term social security system that's related to the long-term social security. Fundamentally, on the health sector, we have a set of institutions, laws that develop and regulate the goods and services consumption to promote the health of individuals, groups, and groups. To improve economic and productive health activities. The health sector in our country has five subsectors. Mostly the traditional medicine is public sector. The private, non-profit, and profit sector, also the sector of NGOs, and finally the short-term social security subsector is it is all part of the health and sport ministry. The elements that rule over the activity of this organization is based on the new political constitutions, but it is important taking a note to it. Article 18 establishes that all people have the right to access health systems without restriction or discrimination. It is a single system that is universal, free, equitative, intercultural, with warmth and social control, based on the principles of solidarity, efficiency, and co-responsibility, and it is developed through public policy across all levels of government. It is important to watch the importance of the state to health, and it is reflected in this article. Article 35 establishes that the state, in all its levels, shall protect the right to health by promoting public policies that are set to improve quality of life. The health system is unique and it includes the traditional medicine of the indigenous nations and others. Article 45 sets the frame for social security. It establishes that all citizens of Bolivia have the right to access social security, and it is provided under the principles of universality, integrity, equity, solidarity, management unity, economy, opportunity, interculturality, and efficiency. One key element of the Constitution is that it is established that the state must work along with society. It is truly important because paragraph 2 broadens on the aspects of Social Security, where we highlight the topic of pluriculturality, economy, and efficiency, which are elements that have been added to the classical concept of Social Security we all previously had. The Social Security regime covers disease, epidemics, catastrophic diseases, maternity, fatherhood, professional risks, labor risks, lack of employment, invalidity, old age, and death. We mix short and long term. In the short term focus, we are focused on epidemics, which was not part of the Social Security Code, and the topic of catastrophic diseases. This has been reformed during time and it allows us to address comprehensively all patients. Which are the key elements of Social Security in our country? Social Security in Bolivia comes as an endeavor that aims to improve the social climate. The Social Security Code dates from 1956. It is relatively old, and it is a set of laws that aims to protect the health of the human capital of the country, the continuity of their livelihood, and the use of those who are idle, and the improvement of the living conditions of families. These are the principles that are set up, as I mentioned previously, for Social Security and that are broadened by the new constitution. Management unity, the idea was that there was one only institution to set all demands for both long and short term. But in Bolivia, we have different managers. However, through the actions we are performing, we're trying to create mechanisms that are unique for control and regulation so that everyone do the same thing, even if it is from different places or actors. Solidarity is important because we don't have a single source of income. Everyone provides according to their wage level, and those who make less are carried by those who provide more. This is how solidarity works, and it is very interesting. Universality was always set up as an universal endeavor, but as I previously mentioned, we have a public sector and a private sector for Social Security, and Social Security has 15 to 18% of Bolivian population, and this 80 something percent is covered by the public system, that is the state. Social Security on the short term, sorry, is based on a given model, and the universal health model is based on a Bergier model. So it is a type of mixed financing on this plurinational state. The fourth principle is efficiency and opportunity, which has to do with the fast access to health systems and also economy, as the conditions must be provided to have a sustainable performance. Next one. On December 14, 1956, the Bolivian Social Security Code was based on the principles I just mentioned. On April 14, 1987, with Law 924, it is defined the maternity and professional risks with 10% of the earnings of those insured. It also separates short and long term administration. That's where we divide both short and long term, and we are in charge of all short term security. This is for the topic of disease, maternity, and risk, and professional risk. Just as I was mentioning, the disease regime says that we are in charge of disease and maternity, family allocation, and professional risk on short term. And on long term, we have discapacity, old age, death, and professional risk on the long term. Which are the elements that are in our charge? Mostly the prenatal subsidy and the breastfeeding subsidy. It is distributed and allocated according to SEDEM. It is a company service. The future mom and the breastfeeding mom receive a subsidy that is a set of products that sum up to $300, I believe, if we want to see it in a general perspective. And it provides cereal, milks, and other elements that help guarantee the baby and the baby to be born will have the necessary nutrients. And thanks to the analysis we've seen, the subsidy is actually for the unborn child or the breastfeeding child. We've had several legal problems in regards to the company or the father, because sometimes the subsidy was sort of like a punishment to the father who was employed, but the benefit is for the baby, and this is on the Constitution. So regardless of the working relationship that the employee has with the employer, the subsidy must be fulfilled. So it is interesting because the concept of the state protecting someone is to the baby, not to the mom. So in money, it is a natality subsidy. It is around to a minimum wage, So it is an incentive for the first needs of a newborn child. Also, the employers are in charge of the medical services. It is said on the law. It is external consultation, both for basics and specialties, hospitalization, the provision of medication as a comprehensive issue. All medications must be provided. We are limited within the state so that through the rationing process of medicines, every 2 years we establish the national list of medicines. It establishes the medicines that the system must provide. However, if the patient needs another medication that's outside of the list, then there's a specific procedure for the purchase. There must be no limitation for medicine provision. We also have a surgery process. All surgeries must be covered, including the necessary elements for the provision of the surgery, and we've been currently developing transplants. Despite 40 years ago, we performed the first transplant in Bolivia. We are currently trying to regulate. And as you may know, transplants have several factors. It is even related with organ trafficking. And the state has provided a transplant law. And what's most important is that we need to promote transplantation because we are fully aware that transplants, especially for kidney, which is the most frequent, allow to solve problems across patients. And we are trying to work with bone marrow transplant and other tissues that help patients. Also, vital protheses are provided both for those who are the beneficiaries and the holders of the Social Security account, and diagnosis secondary services. We cannot pay, for instance, attention received overseas. It is a limitation of the system because sometimes the patient needs a transplantation of more bone marrow, and we are limited in that regard. But the state overall does not have that policy, and we need to develop it. Next one. Now I will give you a glimpse of what the short-term Social Security Provision Authority does so that you can know, so that you understand better what we are in charge of and what the law states for us.
Creating the short-term Social Security is based on the Supreme Decree 3561 dated May 16. So we are about to have 6 years. The purpose of this is to regulate, control, and monitor the short-term Social Security service. As an authority, and I've been part of this team, we have designed and forecast this Supreme Decree. We want to create an authority to make a difference from other entities like the National Institute of Social Security that didn't have capabilities for sanctioning. It was just an institution for regulating and providing counseling, but it didn't have sanction authority. So, in order to implement all the policies to be enforced and to be developed by managers, we created this concept, authority, in order to have capabilities for sanctioning so we can enable all these proposals. The mission of this unit is that we are the independent entity for short-term Social Security. We provide technical, administrative services in the framework for a good life. Our vision is that we would like to be a well known institution at a national level with the best control and monitoring systems to safeguard the rights of the social security holders. And what are our main attributes regarding health? The first one, and one of the most important ones, is to implement the comprehensive model of attention for health. When we started doing this analysis and presenting to you the code, we were focusing on uh, disease management, maternity, and professional risk, but we didn't consider promotion, and prevention. Therefore, the development of security has focused on assistance services. We have hospitals, we have uh, a poly doctor's office, but we didn't consider a comprehensive approach. The Caja Nacional is the only model that has been implemented 30 years ago, but the results are not very elaborate yet. We still have problems in its implementation. And the idea is to extend this process for care to prevent disease as well. At a certain time, when we were developing Social Security, we set forth that 5% of collections of Social Security were going to be provided to the health ministry so they can promote preventive approaches, supporting Social Security works as well. So we would like to change this because this is an undergoing analysis, but of course we have been doing some progress. However, not all the managers are going to be addressed the same. And we also have some issues with the entes gestores because they don't have a full coverage. They have some limitations for economic reasons mainly. And we have to control health care services. We have a lot of problems, especially because services are overwhelmed, they are saturated. It is complicated to give urgency services because sometimes we have a lot of problems. And we have to rule fringe benefits and contingency plans with emerging diseases like COVID or natural disasters that have been generating a lot of concerns in the social security framework. These are the elements that we are considering in order to provide a good service. And we are about to design health indicators for epidemiological profiles. This is kind of difficult because a lot of uh, entes gestores or entities don't have a modernized institution yet. And we also have external services. When we have detected bad practices, we develop an external audit to confirm or to reject any claim. We address some complaints, and this is happening often because we receive a lot of complaints. But it's very important to provide response to all these complaints. And the state has been working hard on accreditation of services. And we separated this in two stages. One is enabling and defining basic characteristics for the equipment, infrastructure of human resources for services, and then the accreditation stage that has to do on how these services are working, if they are good quality or not. In the financial administrative field, we have to standardize the specific rule, and this is very useful to standardize the standard that all the management bodies are using and to evaluate the sanitation infrastructure to promote the database of management bodies and budgets and annual programming. And we carry out special audits operational and financial. And we work with the uh, standardization of management bodies or entes gestores. Within the attention for people is to monitorize the duties of employments for insured people. We focus on register all the requirements that people have to fulfill to be part of short-term social security. And we have issues, especially when we have to register a special beneficiary, because conceptually, we have problems when we are going to register parents. A lot of management bodies don't want to do that because it's a high cost to register an elderly. And then regarding registration and uh, uh, this creates an imbalance because companies have to make a process when they don't want to be registered anymore with this agency and they want to change. It's a very complicated process. It's not as simple to develop this, but we are working hard on this because we cannot have a massive process of uh, removing from the registry a lot of people. We have to take into account economic aspects as well. So we have to take into account health, care, financial, administrative matters for both entities. We have some problems regionally because we have a lot of people that have registered with one entity, and even though they were having good results, they are having a lot of problems. Or in another cases, a large company has closed up and they have generated some issues in regions, and we have to decide actions. So register and their region. Uh, Removing the register of people has to do with administrative matter. Uh, And here we are working with a new model that we would like to implement to address in a direct manner all these complaints in such a way that in real time, when we face the problem, we have to solve it. Because when someone files a claim, they don't receive an immediate answer. They present a complaint, and it has to go through a process of 2 or 3 days, and maybe it's even a week, so it's not a direct answer. So we are designing a project to provide real-time answer in situ. And family allocations are important. This contribution of 2,000 Bolivians per person, many companies would like to underline this. They don't want to pay for this fee. And we need to work with companies. We have to send them notes or sanctions if they don't comply with this subsidy. So we are trying to recover these resources to grant them to families. And this is accomplished with all the actions that we have implemented. We have good success. And finally, we monitor subsidy, the universal subsidy, that it's a project from the Ministry of Health that provides the subsidy that I mentioned to you for mothers that are not part of the um, management bodies and they have been enrolled. So here we address complaints, and we are very interested in this field because here we have to work harder and we have to relate work health and prevention with promoting general health matters in such a way that we can develop what we mention is the labor unit. Workers and family are considered to receive comprehensive measures. And why do we do this? Because opposed to a public service because they have a geographical approach. If it's a municipality, a neighborhood that can be controlled with a geographical mechanisms, is different because as a social security entity, we know where we have our population. In a certain neighborhood, we can have certain number of registered people. So this has to be a comprehensive action. So in this case, the development of the labor community will help us to generate actions in companies that are going to be good not only for employers but for their families. And we also have external medical audits that has help us to generate preventive actions. The idea is not to punish, but when we identify serious problems, we recommend some legal sanctions as well. And these are all the management entities that are part of our responsibility. Here we have 14 entities. Social securities are part of that. This is the only, and they have 7 management entities that are located in each one of the departments. The main entity is the Caja Nacional de Salud, National Health Box or entity. And what are the objectives that we have as an institutional management? Mainly, there are 4: to monitor and control the right compliance of the standard for prenatal subsidy, all the things that I already mentioned to you with transparency. This is done through the legal department to carry out and control the fringe benefits of health services and to monitor the um, administrative and financial environments. And this has to do with the development of systems and other actions that we are enforcing. Next. Regarding the first institutional goal, family assignations or allocations, this is what we do in a nutshell. An operation, the operation that we have implemented, this is just a report of the things that we have been doing during 2023. We had to monitor the distribution items as them that operational is part of the distribution of subsidies. And this is done not only directly, but also we do it through supermarkets and monitoring vendors. We go to visit their sites to see if they are manufacturing all these subsidies with quality and if they are in fulfillment with the standards that we have implemented. Food safety is very important.
Across the year, we have had 132 reports, and if you take a look at the lower right part of the screen, you'll see the evolution from 2018 to 2023, where we are gradually increasing the fiscalization processes. Here we have the complaint resolution mechanism, and I was mentioning how we make companies pay this subsidy. There's always a trend to save, and they try to skip it. We have received 1,004 complaints and 107 verbal consultations, and this is across all 9 departments of the country, and we've made 1,700 persons recover this benefit that was interrupted for internal company reasons or even companies who don't want to pay. This is a very important work because, as I mentioned, we are guaranteeing that an unborn child and a newborn child receives this subsidy that's established on the norm. You've seen the amount has increased in 2022. We had 700 cases, and in 2023 we had 1,700. Regarding enrollment, re-enrollment, and disenrollment, likewise, we've received complaints. We've had 500 complaints, and this is increasing. It is important to highlight this because, in a way, people trust us and our work, and now they increase the complaints. More complaints are something important to look at. This helps us feedback the management bodies. If we have a recurrent problem, then maybe there's an issue with the construction of the law. Or we make also general evaluations. It is not only a specific problem, but we need to see if we are failing in making the rules come to fruition. We also need to work on the middle and long term with the different management bodies. In our second institutional objective, next one, first of all, we identify how many establishments we have. Where are we going to work? Out of 4,000 establishments, this is information for the national system. On the Bolivian level, we have 4,267 health facilities. Out of them, 79% are public. And here we can see that our health system has a deficit included in the number of establishments that need to address a given population. These establishments are distributed in an axis that's distributed in Cochabamba, La Paz, Potosí, and Santa Cruz, and the rest of departments have less facilities. Here we have a detail on the health system institutions. Here we have the health Caja de Salud or insurance company. This is over 50%. And it is distributed across different levels of attention. Here we have 23 establishments of the highest tier, and we have 286 that are of the first level of attention. So we are relatively balanced, but the first level is different for the public system. Regarding the persons who have insurance, we have 1,600,000. It is surprising for us because up to 2022, apparently we had almost 4 million people insured. And if you take a look at the statistics of those who receive insurance, we were reaching 4 million. However, we have established an insured database for all of to address this situation, and we've seen this surprise that suddenly we have less insured, and the population was inflated. It was overdimensioned due to several factors. Chiefly, we have a lot of people who are seemingly insured. Sometimes they have two companies insured, and then I changed, but the other company did not disenroll me. So I was doubled as an entry on the database. We tried to clean this database, and this is the result. And this is concerning because definitely it is very different when you are talking about 4 million insured people and you calculate the needs of that amount. It is something completely different when you have a fourth of that. So we are working with the BTPA because working from a manual base to an informatic or technologic system is tough, but we are working on it. Probably in a couple of years, we'll have 100% of the population cleaned. But currently, we are working with most of the holders. Okay, but we are dealing with problems with the beneficiaries because the system, when someone is enrolled, then you need to enroll the children, parents, and others. So sometimes there is no need to enroll everyone, and then there is lots of people who are not in this list. So the demands of this new database call for the person to go personally and update the data. That's where we are facing problem. So the support, the progress we are having is important, and we probably will reach an adequate number regarding population. Next one, please. So I was telling you that the rehabilitation is also important for us to work in a quality implementation system. The idea is to take the core of the management bodies, and the idea that we're working about transforming the system is first going to the base, transform it. That must be from the bottom up. If we don't have a properly equipped health system and we don't provide proper equipment, proper personnel, then it would be hard to transform the system. Therefore, rehabilitation is the base element that we work on. And now the 355 for 2023, we have performed 64 rehabilitations, and in 2022 we performed 83, and so far we are working with 64 in 2023. It is complicated to increase this figure because most of the Social Security short-term establishments have over 20 years of functioning, so the structures are not modernized. They are relatively old, and thus it is hard to rehabilitate a structure that does not have any compliance on requirements. We have fully different requirements, larger. So transformation is something big that is not something that's done overnight. It takes years, and sometimes we need to build from scratch again. A project takes anywhere from 2 to 5 years to implement. So it is quite a large amount of time. So in solving these rehabilitation issues, the next management will have more complexity, will have less projects, but we need to work on this constantly because we are interested in having the proper infrastructure and human resources and equipment so that they have the minimum that's needed for a services amount that they provide. We are working on that. It is an important step that we are developing. Next one, please. Once the facility is rehabilitation, then we work on accreditation, and we need to see how the patient is addressed, how the procedures are performed. This is based on the Joint Commission that you probably know that has to do with the implementation of processes during attention. We work with attention from the moment the patient sets foot, and then the management of drugs of the health system. So it is a more detailed work. And so far, in 2023, we have worked on accreditation for 26 establishments. It is important because most of Social Security has reached a status quo where they don't want to improve, but we are making them wake up. We have created this process. In 2021, we had only one accredited organization. The rest was not interested or was reluctant to do it. For 2022, we work with 14, but this has required the stimuli, not only meeting with directives, with the hospital directors and regional directors and management on the national level. It was a heavy lifting work, but we did it, and we work with them to have this full process where we have a team that's working with doctors and nurses and the internal accreditation to achieve these results. It is not something that you say, okay, by 2021, we reach letters to pretty much everyone. And the result was very poor. Only one accreditation was done on the last month of the year. So we were pretty much reaching zero. And for the next year, we have 14. And now we have for 2023, we are working with 26. For 2024, we are hopefully working with more institutions, but we are progressing on this implementation of quality assurance accreditation, and I believe it is important to do it. Regarding medical audits, we have challenges and not so much of the will to implement this function, but it is a regulation problem for those auditors in Bolivia. If you want to be an auditor, you have to have a 6 years experience and a course of 600 hours. It is a requirement that was set up in 2005, and it is established in a supreme decree. And we need to work with the medical college. So we are in trouble because the Medical Audit Society does not release enough personnel so that we can have enough audits. We have audited about 15 contracts and we have only fulfilled 10 positions. We have 5 vacancies. We have even had a Facebook calling to see if we can identify someone else, but it was to no avail. And we have several work audits that are still pending. We have worked with 25 services for audits and also 42 medical audits that are special and induced, and 109 fiscalization for medical audit committees. It is important to watch over this because we have several problems in the implementation of auditors. Next one, please. Regarding the management sphere, next one, please. We are auditing with the goal of working on the problems we identify. We have issues with acquisition of equipment, medication. These take sometimes excessive amounts of time, and sometimes they are even void before we receive the product. If we don't have an effective medication supply, then we'll have an issue with supply. And in 2022 and 2023, we have important supply issues. We also do supervision and oversight for the performance of activities, and we have worked with 82 supervisions so far up to 2023 from the beginning of our operations. Regarding institutional management, we have to consolidate the technical, administrative, and legal basis of our work. Basically, we will set up the unity of information technology. And here probably is where we will talk a lot and see how we can establish some sort of interchange of experience and exchange, because this is the first experience we have in Social Security for the implementation of this insured population database that is automatic for all population. We basically need to see a system that's a computer-based system. The idea is that all entities have a single centralized database that allows us to work properly and to provide operations for the real-time update and record. We need to have the real-time information. It is worthless if we have some sort of delay, be it weekly or monthly.
The idea is to have only one source of information for all the management entities that oblige all those entities to have validated information, because there have been cases in which we have received information that hasn't been validated. And it has to help us to minimize the requirements for right holders. Even though it sounds funny and old, if you want to receive service, you have to present your card and it has to be stamped. So it's a manual process and it's quite a hassle. You have to go with your card, it has to be validated to receive service. It's terrible. This should be validated automatically from your contribution to the database so you can have service enabled. You don't need to do any other document than your ID card or your DNI. However, we have to bring our card as a right holder, and oftentimes they ask you for many other formats. It's a lot of red tape. The idea to have a unique database is to prevent having all these hassles. So the moment someone feels sick, they present themselves to the doctor's office and they receive the service. With this, we are going to enhance monitoring and control of services provided to insured people. And as I mentioned, with this BDPA, we have identified 694 the database of insured people that we have. And in the largest fund that we have more than 1.5 million insured people. In this year, the entities were publishing the fact that they had more than 3 million people insured. So it's quite a low figure vis-a-vis what we have reported. The next slide, please. This is a scheme of all the projects that we have developed. Within the proposal that they asked me is to provide you an approach of the things that we would like to implement. How are we going to face some of the issues that we have regarding social security? So, together with other entities, the Ministry of Health, we are working on implementing the short-term Social Security Congress. What is the current problem? What are the main problems that we face? We don't have enough capabilities to rule Social Security. As I told you, every entity management, they are independent, so they generate their own regulations. Some of them are not related or they are not fully in compliance with our regulations. As I told you, regarding enrollment, the enrollment of a father should be automatically done. This, however, in the oldest concept of the code, to register your father, you have to show that your father was unemployed and that they really need the service. So it was a very extreme concept with the regulation of enrollment. We just decided that the only requirement was to prove that there was your parent. And we have a national act for that. So it's not a willingness approach. This is something that has been supported legally. However, some of the management entities don't want to implement this and they are requesting other requirements. We have some management entities that have a more harmonic development and they invest on social security services, and others that allocate a lot of money for administrative issues. We have high inefficiency in the healthcare expenditures. The administrative management is not the best one. Segmentation and fragmentation. You have noticed how many management entities we have in Bolivia. It's very complicated to harmonize the work of all these entities because they have different approaches. So, in a nutshell, we have a low, poor quality in the healthcare services. We are trying to enable accreditation to help us to enhance this issue, but this is going to be happening in the in the long term. What is the general aim of the event? To develop the Congress for short-term social security of the main actors, to set for guidelines, policies, and strategy for transformation in the short, medium, and long term, to design policies that will help us to solve the problems for social security issues. This is not going to be easy. To put together all the stakeholders and harmonize them is not going to be easy because they all have their own desires and their own proposals. So to reach an agreement is going to be difficult. And from there, we have to develop strategies. So we are facing a lot of complexities. But the idea is to have centers of transformation to keep on moving forward. We are going to focus on four main aims: to analyze the current regulation with all the knowledge and the experience that we have in the short-term social security. We have noticed that there are a lot of that currently we have a lot of regulations. Besides the code, we have more than 20 pieces of law that are regulating some aspects of the social security, ministerial solutions that make very complicated to learn more about social security because you design a new standard and it contradicts an older standard. And I am not exaggerating. There are times where we have serious problems. So the main idea is to have a new code for social security that transforms the sector. And currently, the country is going through elections. It's going to be a very complicated process. And if you want a transformation within this process, it's going to be even more difficult. We have to propose a new model for comprehensive care. In some areas, they are still working with typewriters. And if you don't have a system that has been standardized, maybe you can have computers, but you don't have a system, a standardized system. When you have a system for management, then you are using a computer properly. I was in a warehouse visiting for monitoring medications, and the agent was looking for the medication with the typewriter. And if I ask for more information about the medication, maturity date, and so forth, they didn't have information at hand. So the computer was just an old file, but in the computer, they didn't have a system. In some management entities, they don't have an appropriate system to standardize or to link all the information between hospitals and warehouse. In the pharmacy, for example, they didn't have information about the stock or the inventory. So it was very difficult. And this technical management issue is very important. It takes a lot of time, but we have to do it. And we are promoting the enhancement of the comprehensive care model. We were focusing a lot on administrative issues, but not in healthcare. And we need to carry out a deep diagnosis because every entity have their own way to implement their financial strategies. So we need to have standardized in order to benefit from this. And we have different access. We are going to work in the policy for family health and intercultural and community health to prevent diseases. The next one. In the management model for social security, the issue of conduction and regulation. We want to design an axis that will allow us to have more capabilities to conduct and to regulate. Management modernization, to implement IT systems, to implement agile administrative processes, and avoiding red tape. Next one. Axis 3, diagnosis of economic situation and analysis of problems and proposing solutions. Next. The axis 4 is one of the most complicated ones because this will allow us to analyze the current regulation for social security. And as I told you, it's not just an a matter that is lack of knowledge. This system is very complicated. There are laws that are very general, very broad, and others that are regulating very small things, and others that go beyond the health environment, but that have to do with social security matters. So doing an standardization is very complicated. However, we have to do it, and this axis is going to have a specific teamwork to analyze all this. And of course, we have to propose legal foundations to modernize and to make more efficient and sustainable the organizational structure. Hopefully, all the information that I shared with you is useful, and I am going to be here for you if you have any comment, feedback, suggestions, or recommendations. Thank you. Thank you so much, Dr. Kolke. It has been a very comprehensive presentation about the Bolivian system. We were gathering some of your questions, but some of them have been answered by you already. And we only have two outstanding questions in the social media. The audience is asking, have you defined some communication strategies to promote enrollment of Bolivian population to social security, to some of the management entities? Another question, specific measures to ensure financial sustainability of social security systems. Would you like to elaborate on those questions, please? Yes. Well, regarding enrollment, we organize campaigns to promote enrollment. According to the regulation, it's mandatory for every individual that starts working as a new staff in the company. In the first 5 days, they have to be registered. This is part of the standard, and the companies are aware of this. And of course, we have had some problems. Some companies are not in compliance with this, but we have fines, and the management entity can fine employers if they don't enroll their staff on a timely manner. And we have had problems because they don't affiliate them promptly. So we are noticing that with the database, we have a management system for the insured people. So we can have a direct register or enrollment. The moment the employer gives an employment to someone, they can fill out the card and they automatically are going to be registered, because you have to send copies of your basic documents. But through the interoperability processes with the card number, we can retrieve all the information, and there's no need to present physical documents. So this is still undergoing. We are still analyzing legal aspect because our social security code dates back from 1956. And therefore, what is set for there are physical documents, and a lot of entities are saying that they have a new code and they don't need to provide physical documents. So we are working on the legal aspects in order to enforce this automatically. Regarding financial sustainability, we have a department that is called plan standardization. They consider all the plans, how the budget is going to be executed, and we issue some recommendations in order to prevent sometimes of some type of expenditures, hiring human resources excessively, because this is something that we have to surveil. And we have to surveil other um, expenditures to be sustainable.
We aim to reduce the alarms that we are receiving under budgets, but it has to do with the middle and long term. What we are trying to address the large issues that we have had that have been due to COVID, because it has had a great impact in our management. Thank you, Doctor. Now we'll have Master Pedro Alcantara. Hello, Doctor. Regarding the Bolivian setup, it is different from what we have in the Dominican Republic. We have short and you have long and short term, and we have three sectors: work, health, and retirement. And you mentioned 18% are private and 82% on the rest is on the public service for health. In that figure, do you mm, include those that are in retirement, and do those laws interacts at some point? So I'm going to retire. Do I have to mandatorily go and enroll, or how does it work? On the long term, evidently, all the retirees through different systems that we have currently working with, we've passed from individual capitalization, and now we have another system that's currently working, but they have the obligation to be insured. So the retirees have insurance, but we have a problem with those who don't have a work relationship across their life and they don't have any sort of retirement. So they have a pension or, or a retirement plan that the state provides. It is not very high, but it's a monthly bonus that helps those who are lacking any sort of affiliation or enrollment. Thank you both. I don't know if you have any other questions here on stage. So that's all the questions that we have also in social media. So thank you very much. I believe the work that you've been doing in Bolivia is truly interesting for most of the conferences here, the legal and social. Teresa can work in harmonizing this and also the management system. I believe it is very in line with this digital transformation. So with no further ado, this is the end of the first panel.